Hi, this is Sue, and I'm so not a TV star. I'm going to try this video again. This is my third try. I hit my Weight Watchers goal in 2009 and have now lost 100 pounds, 108 pounds, and Weight Watchers gave me an award for that. My BMI is 25, and my waist measurement is 34, which is a half-inch more than the ideal for my height, which is 66 inches. If I keep my weight at or below goal and weigh in once a month, I can attend Weight Watchers meetings for free. But fact remains, you can attend Weight Watchers meeting even if you pay once a week for 32 years for the price of one weight loss surgery. I don't think weight loss surgery is a good idea for many people simply because of the risks and the fact that many patients, unless they do the same things I'm doing, that is, count their calories and exercise, can regain a lot of their weight. It's less work to keep off your weight with a good program like Weight Watchers than it is with a weight loss surgery, because you don't have to do all the medical follow-up and you don't have to do the shots and the iron infusions and stuff that a lot of people have to do. So as the TV suggests, weight loss surgery is not the easy way out. The TV media has been saying that the gastric bypass cures diabetes and actually has been suggesting the surgery for people of more normal weight to cure diabetes. But the studies don't show this. At the 2-year point, 72% of patients do have their sugar levels down to normal. But even the researchers admit that they don't know if this is because of the fasting that happens after the gastric bypass or if it's the actual surgery. And at the 10-year point, the Swedish obesity study found that only 36% of diabetics remained diabetes-free. With the gastric bypass, you can develop something called reactive hypoglycemia, which is where your blood sugar levels can go suddenly very low without notice, so much to the point that you could pass out or feel like passing out. That cannot be medicated. We have also found 100 gastric bypass patients who developed epilepsy or seizures after their surgery, and Dr. Paul Ernstberger suggests this might be a B6 vitamin shortage, which would have to be supplemented in shots, and of course insurance doesn't pay for it. Finally, many gastric bypass and other weight loss surgery patients live with a constant worry of what's going to happen next medically. That is bowel obstruction or non-involuntary vomiting or stuck stomas and things like that. And that can cause a sort of post-traumatic stress disorder. And if you look at all of this and realize that it doesn't work weight-wise for most people or many people, it doesn't seem worth it. No wonder Self magazine called weight loss surgery the weight loss miracle, which isn't, after they interviewed several longer-term patients who had either regained all their weight or had to have their procedures reversed to save their life. The newest procedure, the gastric sleeve, calls for the removal of 90% of the stomach. So it's likely that these patients will suffer similar vitamin deficiencies to gastric bypass patients, and also probably on the long term post-gastrectomy syndrome, which is a bunch of symptoms including fatigue, mental confusion, B12 shortage, and others. One DS patient, this procedure also calls for the removal of most of the stomach plus the bypassing of most of the small intestine, said she messed up her stomach with ibuprofen, taking too much ibuprofen. But of course, if you have a normal stomach, you can take a lot of ibuprofen and you don't have to worry about getting your stomach amputated. Dr. Edward Mason, who invented the gastric bypass in 1965, stopped doing gastric bypass in 1980 after his follow-up showed too many complications. He said, "For the vast majority of patients today, there is no operation that will control weight to a normal level without introducing risks and side effects that over a lifetime may raise questions about its use for the surgical treatment of obesity." He also wrote in 2006 that bypassing the first section of small bowel interferes with the normal absorption of critical nutrients and causes complications related to vitamin and mineral deficiencies such as anemia, iron deficiency, and metabolic bone disease or osteoporosis, or calcium and vitamin D deficiency. This is done with the gastric bypass. They bypass the first section of small bowel. And he also wrote that since the mid-1990s, scientists have learned a great deal about the biomechanisms that influence food intake and weight, and that he would like to see a greater use of simple restriction procedures that do not rearrange these finely balanced mechanisms. He wrote this for the University of Iowa Health Newsletter. So that's about all I have to say, and I hope you're having a good day, and I'll probably see you again for another video.